It's 1969. A man walks into the admissions office of a psychiatric hospital in the eastern United States. He tells them he's been hearing a voice. Just one voice. It says 3 words over and over. Empty, hollow, thud. The staff admit him. They diagnose him with schizophrenia. They give him a bed, a wristband, and a paper cup of antipsychotic medication 3 times a day. Here's what the hospital doesn't know. This man is David Rosenhan. He's a professor of psychology and law at Stanford University. He has never heard a voice in his life. And the moment the ward door locks behind him, he stops faking. To understand why Rosenhan did this, you need to understand what psychiatry looked like in 1969. It was a field in crisis, and most people didn't know it yet. The Diagnostic and Statistical Manual, the Bible of psychiatric diagnoses, had ballooned into a document listing hundreds of mental illnesses, many of them defined by vague, overlapping symptom clusters that one clinician might interpret entirely different from another. There was a genuine, serious scientific debate happening. Could psychiatry actually distinguish between sanity and insanity, or were diagnosis labels just stories clinicians told about patients, shaped by whatever context they arrived in? Rosenhan wanted to find out. His question was simple and devastating. If a sane person walked into a psychiatric hospital and said they heard a voice, would anyone figure out they were faking? He recruited 8 pseudopatients, 3 psychologists, 1 psychology grad student, 1 pediatrician, 1 psychiatrist, 1 painter, and 1 homemaker. Him being one of them. Each one went to a different hospital. Each one complained of the same symptom, hearing a voice saying empty, hollow, thud. Beyond that, they told the truth about their lives, their relationships, and their histories. Every single one of them was admitted. 3 were diagnosed with schizophrenia, the rest with bipolar disorder, and then the experiment really began. Like I said earlier, when Rosenhan was admitted, he stopped faking, and the other 7 pseudopatients followed suit. No more voices, normal behavior, and they told the staff they felt fine and wanted to be released. They took notes, they observed, and they waited. What they found inside those wards was one of the most disturbing things ever documented in a research setting. First off, nobody on staff noticed anything. Not the psychiatrists, not the nurses, not the orderlies. The pseudopatients behaved completely normally. Their behavior was logged as symptoms. Rosenhan took notes, and his note-taking was recorded in his chart as writing behavior, flagged as a manifestation of his condition. Here's one of the most remarkable moments from the study. Rosenhan approached a nurse and asked politely, "Pardon me, could you tell me when I'm likely to be presented at the staff meeting?" The nurse, without making eye contact, replied, "Good morning, Dave. How are you today?" and walked away. He asked the same question to a psychiatrist passing through the ward. Same response. Eye contact broken immediately. Question unanswered. Doctor gone within 30 seconds. The staff weren't cruel. They weren't incompetent. They were operating inside a system where a patient asking a question was understood as a symptom to be managed, not a person to be engaged. Now here's the twist within the twist. The real patients knew. Other patients on the ward, actual psychiatric patients, started approaching the pseudo-patients and saying things like, "You're not crazy. You're a journalist," or "a professor. You're checking up on the hospital." The patients could see what the staff couldn't. The average hospital stay was 19 days. The longest was 52. None of the pseudo-patients were ever identified as sane by hospital staff. They were released, eventually, with their diagnosis listed not as resolved, but as in remission, meaning the hospital didn't conclude they'd been wrong. It concluded the patient had temporarily stopped showing symptoms. Rosenhan published his findings in 1973 in the journal Science, under the title On Being Sane in Insane Places. It became one of the most cited and most controversial papers in history of psychology. The psychiatric community did not take it quietly. One hospital administrator, furious at the implications, issued a direct challenge to Rosenhan: "Send your fake patients to us and we'll spot them." Rosenhan agreed. Over the next 3 months, the hospital staff flagged 41 patients as likely pseudopatients, people they were confident were faking mental illness to infiltrate the hospital. 193 patients were admitted during that period. Rosenhan's response when the results came in was 3 words: "I sent none." He hadn't sent a single pseudopatient. Every person the hospital staff had flagged with suspicion, 41 people confidently identified as fakers, were real patients seeking genuine help. The hospital had gone from unable to detect sane people among the mentally ill to unable to detect mentally ill people among the sane professionals, the same setting, just a different direction of error. The Rosenhan study didn't destroy psychiatry, but it did bend it a little. It became one of the primary catalysts for a complete overhaul of the DSM, leading to the DSM-3 in 1980, which introduced much stricter, more operationally defined diagnostic criteria in an attempt to make diagnoses more reliable. It sparked serious debate about the ethics of involuntary psychiatric commitment. If staff couldn't reliably tell sane from insane, what justifies locking someone away on the basis of diagnosis alone? And it launched a question inside the profession that has never fully gone away. When a patient's behavior is always interpreted through the lens of their diagnosis, Can the diagnosis ever be wrong? Now here's where this story gets a little bit stranger. In 2019, journalist Susanna Cahalan published a book called The Great Pretender, in which she spent years trying to track down Rosenhan's original research, the notes, the pseudopatients, and the raw data. What she found, or rather couldn't find, raised serious questions. She located only one of the original 8 pseudopatients who could be definitively confirmed. Hospital records from the period were incomplete, and Rosenhan's own notes, she argued, contained significant inconsistencies with the published paper, including details about his own hospitalization that didn't match the records she uncovered. She raised the possibility that Rosenhan may have embellished or even fabricated parts of the study, but Rosenhan died in 2012 and can't respond. And now the scientific community faces a strange recursive problem. A study designed to expose how easily institutions construct false certainty may itself have been constructed on shaky ground. We don't know if Rosenhan was a whistleblower, a genius, or a fraud, or maybe even all three, and psychiatry's diagnostic reliability, the thing he attacked, is still debated today. The question he asked in 1969 has never been answered. Can you tell? Now, the Rosenhan experiment, in my opinion, is something that makes you really think about how medicine is in the current moment. If only 60 years ago they were struggling with diagnoses, who's to say they're still not struggling now?